Back pain, it is the #2 reason that people go to the doctor, second only to the common cold. Definitely an epidemic. Dr. Casey Burden of Action, Spine, and Joint talked with us about how they're helping patients overcome back pain. Dr. Bearden, let's talk about how you guys approach this differently than other places.
Yes, Carol. Well, the spine is a marvelous work of engineering, and that's the way we approach it and correct most spinal related conditions from an engineering perspective. And what I mean by that is most people with spinal related conditions such as spinal stenosis, sciatica, herniated or bulging disc, degenerative disc disease, for example, they simply have a breakdown in the normal engineering of the spine, much like a car part going bad. In other words, the spine can lose its overall alignment, strength, flexibility, and range of motion. And that's what we have to approach and correct from an engineering perspective. It's something that ibuprofen or steroid epidurals just can't fix. And it's why most people end up with chronic reoccurring back pain that just never get better. And some of them end up having to have unnecessary back surgery or addicted to ongoing pain meds, which only gets worse over time. The fact is, fewer things will affect quality of life more than chronic back pain. It can even cause organ problems from chronic bloating to urinary incontinence.
Let's talk about two things you touched upon: surgery and drugs. Two scary things for a lot of people. You don't use either one of those.
We don't have to. We take an evidence-based approach using non-surgical spinal decompression coupled with a class 4 deep tissue laser therapy. The laser, for example, is designed to increase energy and reduce inflammation to damaged tissues. And anything with more energy and less inflammation will heal much better, faster, and longer with no side effects. Then we bring the spinal decompression in, which gently opens the spine, relieves the pressure off of the compressed and pinched nerves, ligaments, and discs, and just allows things to heal much faster and more long term. So that the decompression coupled with the lasers, where we get superior clinical results, is just not seen in the market with no side effects.
Let's address this. Is it painful? You said there's no side effects, but is it painful?
Actually, nothing we do in the office is risky or painful. And in fact, most of our patients, they feel like they're in a spa atmosphere. Most people will spend 20 minutes on one of our tables, taking a nap, and they wake up pretty much pain-free.
That's incredible. We've seen 30,000 patients plus since you guys opened the doors, and you're an award-winning chiropractic practice. Let's talk about how you're kind of making things easier for people to make that step and get through the door, see if this is right for them.
Yeah, Carol. So first of all, we have to determine the level of candidacy because quite frankly, not everyone qualifies for this procedure. So what we're doing is we're offering a reduced screening price of $47, which will include your initial trial treatment on one of our state-of-the-art tables. Again, it's very relaxing, takes about 20 minutes. And then we'll couple that with a full plan of action if you qualify for one of our procedures. That way we can determine how much we can help you and how quickly we can make it happen.
It's a great offer. It's at Action, Spine, and Joint, actionspineandjoint.com right here on Charlotte Pike in Nashville. So good to see you.